Yes. We're putting the focus on your health, and we wanted to bring Dr. Baker in. One of the situations, and it's a hard conversation to have, is about vaccines and about getting our kids vaccinated. And that's something that you guys are dealing with on a daily basis, because there's so. What do you tell moms that come in?
So there's a lot of trepidation, there's a lot of fear in their hearts about what to do and how to make that decision for their unborn child, not having all the information. You know, we certainly don't have 18 years worth of data, and we're relying on some observational studies and things like that, because pregnant and breastfeeding women weren't allowed into the vaccine trials. So, you know, this is not just an issue for COVID, it's a bigger issue that we need to study these drugs. But this is hard on women's hearts, because they're trying to make the best decision they can, and they're afraid, and they're just looking for information most of the time. And
it's not just about the vaccine, because there are so many questions just about any medications. Yes. That once you're pregnant, can I take this? What's best for me and my baby?
Like Regeneron, Remdesivir, all of those newer drugs that have come out to treat COVID. Obviously, we're way behind in pregnant exposures and lactating exposures. But what we do know is that those women that are being vaccinated are doing better if they get COVID. And all of the major players, the American College of OB-GYN, the American Academy of Pediatrics, everybody has come out with very strong statements saying to get the vaccine is less dangerous than to put yourself and your unborn child at risk of getting the virus.
And it goes back to, you know, you just listed off a number of credible resources and credible sources. And I think that's one of the things that people go out there and try to find their own information, and they're just diving down into deep, dark holes that...
Fear.
Yeah.
You know, and it's really, that's when women come in to talk to me, I don't make it up. You know, I'm not going to tell them stuff that I don't know. I'm not going to use fear to try to drive their decision. We're just going to try to meet them where they are and try to give them all the updated information we have with all the support that we have. And usually it's not a one-time conversation. We usually have to revisit it. You know, maybe they've had a loved one that's gotten COVID and done poorly, or they're fearful of what's going to happen at their job or whatever. And we just have to keep coming back to the conversation of what we do know, and just try to be as supportive and as understanding of the decision-making process as we can.
And you had mentioned this earlier, the pregnant women weren't a part of any of the trials.
No, and that's pretty common, really.
Yeah.
Pregnant and lactating women are often left out of drug trials, and that's a problem. I mean, we need to do a better job of giving those women a chance to have information that we could use. But what we do, the series that we have are growing. You know, there's thousands of women, and now there's hundreds of thousands of women that are in these series, and we can quote risk rates, and we can quote what we think is going to be good for the pregnancy. And I think we're all on the same page that the vaccine is safer than the virus.
Yeah. And I know a big part of what you do, Dr. Baker, is empowering these women to make decisions for themselves and their unborn child.
That's right. And in the end, it is her body and it is her child. And all we can do is give her the facts and try to take some of the fear away, try to direct her towards those credible sources. And that's my biggest ask, is that you not Google. You know, you really go to the groups that have long guided us in good decision making for medical reasons.
That we have all listened to I mean, we kind of was talking about this when my doctor, Dr. Bradford, here in town, says to me, Andy, we need you on a statin. Mm-hmm. That's his recommendation, and I listen to him because he knows a whole lot more about how my body's handling things than.
It's about trust and building that relationship and knowing that we're not going to tell you something that that is our own agenda, but rather what's best for you. So it's all about trust.
All right. Well, we appreciate it. Where can we go for more information? I know if there could be somebody out there that has questions about medicine, about what can I take. We want you to ask those questions to the right people.
You bet. The InfantRisk Center would love to answer any questions you have, and we could direct you to any of the websites or the credible sources that we'd like for you to start to look for your own answers for, and help us, you know, let us fill in the gaps with what we know as well.
And these are people right here in Emerald that are part of our community. You can ask you can be in a safe place there. InfantRisk.com. Head over there and check it out. Dr. Baker, thank you for always coming in and being so willing to interview, even when the subject gets hard and it seems like everything is hard right now. So thank you for being in here. We've got more Studio 4 coming up right after this. No question.